Hi everyone, welcome back to my channel. So far on my platform, we've talked about various career options that are available to you after doing your BDS or MDS. But that's half the journey, isn't it? That's half the battle, that's one. Because to understand or to figure out what it is you want to do is just getting half of the journey correct. But to actually do it and become successful at it is the other half. That is something that we're supposed to figure out. So the thing about success is it doesn't happen overnight. It's a long journey, it has its own ups and downs, and it comes with a lot of hits and misses, which is something that we miss looking at when we look at somebody who's successful. So my intention behind all of these videos that I'm putting out on my platform is for you all to witness the stories of these people who are successful and are very good at what they're doing. You'll see how there are small parts wherein you will be able to relate to this person, and you'll see how their journey is. You'll understand their ups, their downs. You'll understand what their intention was when they decided on doing something, how it is that their journey took a curve, and what it is that got them to become successful. Because I think there's no better way to learn something than to understand the story behind it. It's just how it is in the movies, right? We never forget a movie that we watch. Same is the case with videos like this. I hope when you understand, when you go through these sessions, you take away some important keynotes or some key points behind the stories of these successful people. So for today's video, we are going to be talking to Dr. Athreya Rajagopal, who's a very famous oral and maxillofacial surgeon. इनफैक्ट आप में से कई लोग उन्हें बहुत अच्छे से जानते होंगे, उनके काफ़ी सारे सेशंस आप लोगों ने अटेंड भी किए होंगे, उनको कई कॉन्फ्रेंसेस में बोलते हुए सुना भी होगा. He is the face of oral and maxillofacial surgery in India, and he runs a very successful private practice in New Delhi. And not just that, he's also equally good at a passion that he follows very dearly, which is cricket. He's gone ahead and played cricket at a national level, in fact, alongside Virat Kohli, which just goes to speak about the level of achievement that Sir has. Now, if I go ahead and mention all of his achievements, I think it'll easily take me more than half an hour or 1 hour to do just that. But instead, let's just dive into the video and understand him, understand his story, understand how it is that he reached where he is, and learn something from it, right? So let's not waste any more time and jump right into the video. If you did like it, make sure to hit the like button, to subscribe to my channel, and to share it with friends you think it might help. Let's all become successful together. That's the only intention I have with all my videos. Thank you and have fun. We'll first start with asking you a little bit about yourself. If you could give us a brief introduction.
So thank you, first of all, Dr. Ishant, for having me here. And it's a great privilege to be speaking to you, first of all. By speaking about myself, I would just say that I come from a very humble background. I belong to, my childhood was all about the armed forces because my entire family is from, they were all doctors from the army, my father itself. And everybody in my family, they're all doctors, but all from the army. So as my childhood, I traveled from places to places, studied in all different schools. Every 2 years, a new place, a new school, new friends. Uh, Adjusting became quite easy because we started letting go and kind of making new friends every time. So if someone asks me who are your childhood friends, they were probably just my 11th, 12th friends that I remember, and I actually still hang out with. And so childhood was all fun, all great things. But since then, it's been a journey on its own, day by day. Coming here, then getting into dental school, and then one after the other things started, materializing, falling into place, and that's about it. I mean, everything else has to come along, and so that's as far as it goes. Speaking about myself.
So your childhood is a lot similar to mine. Even my dad was in the army. He wasn't a
Okay.
doctor though. He was in the infantry. Yeah. So I
Oh,
can relate a lot to your story. We were also shifting every 2 years. So yes, it is all about just adjusting, making friends. And I can so
yeah,
relate to this fact that your actual friends are going to be people from your dental school, because that is the one place where you spend most of your time. I don't remember staying at a
absolutely.
place for more than 2 years. So those 5 years is where I really found my true friends, or I would say the longest associated friends that I have. So that's nice.
Okay.
This is something new I got to know about you. Fantastic.
Yeah.
And so growing up, obviously now I'm understanding that since your parents were doctors, so obviously you must have always wanted to become a doctor growing up then.
So, becoming a doctor, no, it was totally one thing. Yes, my mother was a teacher. My mother wasn't a doctor. My father was a doctor, but everybody else in my family, my uncles, aunties, everyone, they're all different specialists and all from the AMC, which is Army Medical Corps. So, yes, but I still remember as a child. Younger grades, probably sixth, seventh, eighth, and before our exams, my dad would be teaching us and those, last minute preparations and all. So there were days when we would go to the Army Medical Center where my dad was, treating his patients, and I would be solving all these sums sitting there while he's treating those patients, writing medications and lines and lines of patients coming in, and some of them grateful, some of them thankful, most of them, in fact, just looking up to the way I was just walking behind him and the way they would just look up to him, and it gave me great inspiration. So I started relating that that being a doctor, you stand in a way that very few can in the society. So I from my childhood I started idolizing him. I idolized both my mom and my dad for different things. Both of them have had different qualities which we looked up to. But yes, uh, becoming a doctor is something that didn't come as a forceful thing. Nobody forced it on me, but I saw everything around. My father, my uncles, and all they would have this conversation about how they treated this patient this way, and as a kid, I started idolizing. You can actually do well and do good for the society and for people, and make them heal. So it gives you the power to heal. So yes, I started idolizing that, but no one forced me to become a doctor ever. In fact, I had a totally different childhood. I was big time into sports. So I actually wanted to become a cricketer. Very few people would know. I was playing professional also when I was in my 8, 9, 10th, 11th, 12th, and all those things. Because we got when my dad was in the armed forces, 99, we came back to Delhi after Kargil. My dad got posted ahead, and we had to come back. So I still remember we was to give our exams in March, and we came back mid-session. It was probably in December or January. So new school and exams 2 months away. So things like that, and yeah, memories, all of them memories. So yeah, I had a very fun childhood, and if someone asks me what I want to relive the same things again and do the same thing again.
Yeah, yeah, I'm sure I could agree with you on that totally. So then, sir, how was your experience at dental school?
It was wonderful. I think it's just that experience which all of us had the same experience. I think the first few months you're actually trying to get into the ritual and the routine and dissection halls and the physiology, this thing, biochemistry. I don't know what all now. So it's all in the air now. But those memories were beautiful, and yes, that school was amazing for me because I actually channelized all my energies once I didn't have to go into sports. And we as army kids, we were multitasking most of our time. So when we stopped our multitasking and all those tasks, and you channelize them in one place, it's always fruitful. So one thing I can proudly say is I worked very hard at dental school, and I was, you ask anyone in my family or anyone around me in school, also dental school, they will all agree that I actually worked quite hard. So there were no shortcuts because I had nothing else to do. I only thing I did was actually work hard and study, and that was actually that benefited me completely, because I still quote those concepts which I actually studied back then, particularly pertaining to the medical departments. You talk about anatomy, you talk about physiology, pathology, anything that you talk about, pharmacology. So all those working hard with all that has actually helped me out and still helps me out till date. So uh, studying, working hard, enjoying, having friends, It was an experience, and I think everyone has done the same. So yeah, it was beautiful. I can't thank my friends for being there around me and helping me out when required. So yeah, I thank everyone around me for that.
Fantastic. And since you were so focused at the time, so was it already clear to you that you wanted to pursue a post graduation in oral surgery at the time, or was it a decision you took later on?
No, so I was very clear about what I wanted to do. In fact, I started realizing what I wanted to do very early in my dental school, and it was all or none. If I wanted to do, I wanted to do surgery. Otherwise, I didn't want to do FDS, and I was very clear about it right from the start. In fact, I had no break between my UG and my PG, so I straight away got into my post graduation, and I knew what I wanted to do. So it was always going to be surgery for me. Frankly, I couldn't understand anything else. So it was quite a this thing, I never found solace or peace with acrylic and prosto, or the Holly's appliances, or wire bending in ortho, or curettage in perio, or tel show do in pedo. So all this never made sense to me. The only thing that made sense to me was the surgery department. So I would just go and hang out there right from the start and look for opportunities to find work there. And looking at all the pictures of how you can fix faces, do this, do that, and there's so much that you could do and actually make a difference. The only thing I wanted to do was surgery. So I started focusing very early, and that is when I realized that I had an inclination towards surgical specialty. But I had an option because I had my younger brother who was also in dental school, and so I actually fixed him up in a big proper manner. So one day he came up. I was already doing my post graduation, and so he came up to me, which specialty should I choose? So I still remember I helped him choose prosto over any other specialty, because I knew if he didn't take prosto, no one else in the clinic will do prosto. So
That was very thoughtful and very far-fetched, you know.
it was a very smart move. So, and I still remember when I was in final year, and this fellow was a first year postgraduate. He came all drenched in acrylic and saying, "All this is because of you." He said, "I wanted to do orthodontics, and look at what you've made me do. I have acrylic in my hair, in my clothes, on my clothes, in my clothes. All this is because of you." I said, "Don't worry, you'll be fine. You'll be fine. The clinic has to run. You'll do well." And today he's enjoying himself being a prosthodontist.
That's fantastic. That's some story. That's great, sir. So I hope sir is happy now.
He's very happy. He is very happy because everything for him is Emax and Zirconia now. So
That,
he's
yeah. So
very
no
happy
more
and sad.
acrylic.
Yeah, so the team, so dental department in our centers are very well focused. My wife is a periodontist, and her name is Aishwarya. My younger brother's name is Abhishek, and Aishwarya is very good with her periodontics, conscious sedation, but she's excellent and exceptional with her endodontics. So I'm sorted. I get the easy part to do, and they both do the hard work. So yeah, that way I'm blessed, and so that's how it is.
Yeah, you've got a great team backing you up. That's good. So we will come to your clinic, sir, in just a little while. Meanwhile, I just want to ask you, for all of these students who have not figured it out yet, because it's very clear to you, and I have had a few friends who had it very clear ki if we want to do PG, we are going to do it in this, otherwise we are not going to go ahead, right? But what do you have to say to the other students who are not very sure ki isme karna hai, usme karna hai? What is the message for them? Should they stay back, take their own time, and then work somewhere, and then understand what is it that clicks for them, or is there something else that you would advise to them?
See, first of all, it is specific to very few, and it is a very you can't generalize all this to every candidate, because every doctor person becoming a doctor, a general dentist is actually one of the toughest things to be, because you are actually going to deal with everything. And I actually feel that they are the best people when they become experienced with a few years and years by years. You see, a general dentist actually is a box of knowledge. So they've actually seen it all happen. If someone genuinely wants to do a post graduation, they should straight away go and do it. It's not just the tag that I want a tag of being an MDS, so I should do it, this and that. It's about focus. It's about being specific. If your gives and your asks, as they say, are balanced, you will know what you want to do. So if somebody wants to do just an MDS and they are not specific, but they want to run a clinic of their own and they want to pursue it forward, they should actually choose what they want to do. But don't get into any field forcefully, because then it becomes a burden. I mean, either you know what you want to do and everything falls into place, or if you don't want to do and you're just generalizing, then it's the easiest. If somebody is not fixed about just doing a degree in prosthodontics or orthodontics and this and that, they're the easiest. But then they should actually, think a little more. They will have to rethink their strategies probably. And the long-term thing, always look at a 5-year plan. It's not a short-term benefit that you come out of post-graduation, everything is beautiful after that. Yes, everything is, but it takes time. Everything takes time. So those next 5 years, actually, you always have to have that plan with you ready. So yeah, that's
And
what I would say.
while you were done with your post graduation, so were you clear in your head, like what is it that you're going to do now? Were you going to get into academics, or did you always want to open your own practice and get into that and upskill yourself?
So learning is every day. I mean, you have to keep upscaling because we are all students. I mean, even today, I'm actually speaking. I'm no one. I'm just a person with a little bit of experience. We're all learning every day. We learn something new from whatever we do. And if you stop upscaling and you stop learning, that's where you actually give up and you're not going to grow at all. So my simple this thing to my dear colleagues will be who are coming out of school now or looking for an option is keep it as simple as you can. I mean, don't try and make it too complex. Just be focused. Because till the time you're not focused, you're losing focus every time. Oh, let me do this just because that person has done it. Let me do this just because that person has done it. It's not going to suffice for you or do well for you. Something might do well for you that might be as good as that for the other person. So yeah, but learning you will have to keep doing. You'll have to keep advancing, keep learning, keep integrating new things, new technologies, because at the end of the day, whatever we learn is for the benefit of our patients. And if we can do good for our patients, that happy face and the thankfulness and the gratefulness is what we are actually going to sleep well with. So yeah, upscaling and learning is a continuous process that can never stop.
So I'd like to mention at this point to my audiences here that these are golden words and they're coming from somebody who's done a fellowship in aesthetic surgery, aesthetic dentistry. He's done a fellowship in clefts and also implants. So, and he's also finished his PhD. So, a very well-learned person, and you studied so much. So, we'll start with the aesthetic dentistry. So, how did you, facial aesthetic medicine and surgery, how did you go about this? So,
So
exactly how did
when
this work?
years back when I was getting into this, my simple concept was I used something known as a toxin, which is botulinum toxin for two cases on temporomandibular joint dysfunctions and cases of neuralgia to actually try and see if it benefits these patients. And the TMD patient was actually very comfortable after this shot, and then we treated the reason why the TMD was happening, because treating those occlusion problems causing the temporomandibular joint dysfunctions take time. So in that intermediate, period when the patient's bite is actually getting into a more comfortable position, you have to find a way that the patient stays off medications for a long period of time. You can't keep the patients on medications morning, afternoon, evening for months and months together. That's where the toxin actually helped, and that's where my interest grew. And that's one after the other. I started learning. I started incorporating. I trained so many people I need to thank, so who were kind enough to teach me, train me, share their knowledge. And that's where the journey started. It was, and ever since then, it was not as if anything else helped. It was also my surgical skills and my surgical knowledge which was actually helping me, because most of the things that I kept on doing after all the trainings, you have to find your own niche, and you have to find your own way forward. Same things can be done differently as well, and you have to find new ways to actually give results to the patients. So yeah, all these are very good things that we learned, but innovating and coming out with your own way of doing it is actually depending upon the participant or the doctor who's actually trained.
Absolutely. And I think all of this falls back to the same thing, that you need to keep upskilling yourself. You need to learning more. That is also how you are going to find an interest, an area of interest, which you can, call your niche later on. So that's fantastic, sir. And from my understanding, I think you run a very high end and a very fantastic clinical practice. And so, what does a usual day in your life look like, no, so to speak?
So the usual day is I try and keep it as simple as I can. Uh, so my first thought in that is actually I try and spend as much time as possible with the family, which includes everyone at home. I have a 5-year-old kid who's turned 5. I try and spend as much time as possible with him. Ashwarya, Abhishek, my dad. I try and spend as much time as possible at home. But with the current schedules that everyone is going through, sometimes you need to balance the work life and the personal life, which I find it a little tough sometimes. But a routine day will be getting up. I'm not a 5 o'clock getting up person. I don't do that. So whatever time I wake up at, I'm not disclosing that. So I mean, but usually around 6:30 or whatever when I wake up or this thing, first thing will be just playing with the little one for about as much time as possible before he leaves for school, and then take out half an hour for myself if possible, because it's important to try and take out 30 minutes in a day to try and work out a little. Keeps you on your toes, and then when you come back, you feel with the release of the endorphins, you actually feel great, and all that. Your head feels light. So then I head out to work, which can be hospitals. Mornings, I'm usually working with my maxillofacial surgery, oral surgery, and till as long as because different hospitals, different centers. Then I come back to my clinic. I have fixed days in my clinic where I have my patients coming in for any kind of treatments which require my presence. Uh, Otherwise, it's usually, and then the time frame is such that usually there's no time in the evening. It can be 7, 8. Usually 8:30 is the bare minimum that we wind up by. But one thing I made it a point, I don't really work on Sundays.
That's
And
good.
I always take a Sunday off unless there's an emergency case of a trauma or something which needs to be operated, which is probably once in a month or maximum twice sometimes. But otherwise, Sundays I don't really work too much, and that is the time what I actually like to give to my family. But in the recent past, that has changed a little because the workshops and all those things which I take, mostly there on Saturdays and Sundays. So either I'm traveling or I'm at home. So, yeah.
So, sir, would you like to tell us a bit about the workshops? How do you, if you want to talk about them, we can have a discussion.
So workshops, we actually train on a lot of different things. I mean, implantology, surgery based, aesthetic based, specific one-to-one workshops. We've got fellowship programs running, which is a one-of-a-kind fellowship in the entire country when it comes to aesthetics. It's got a cadaveric workshop as well, and that's how I actually train. So my company, which is Aesthetics One. We actually have trained a lot of doctors, and it's that's what we focus on. Usually weekends, 2 weekends in a month, we're always training. Um, and then there are big conferences that happen. There was a recent big conference that we were able to organize, and there's one more coming up in December. So we're very prompt on our workshops and our conferences, and we're trying to actually, our main aim is actually to train doctors the way that actually they can incorporate new things. Because if you just talk about aesthetics, it never was a specialty. and it never belong to anyone in particular, but that you'll have to find your comfort zone and what you can promote in your practice. Because after a certain level, what you've reached in your practice, you want to find new ways to actually grow. And if they can actually help out your routine practice, why not? So upscaling and incorporating new things. And I still train wherever given an opportunity. I will just go and learn something new which will benefit me in any way or indirectly helping my patients out. I will straight away run and go there. I mean, I have no this thing inhibitions at all, and I have learned so much from the doctors who come as trainees as well. So while teaching itself, I learned so much. So every day, I mean, there's a new learning curve. So yeah, workshops, fellowships, master classes of every kind, right from surgery to implantology to aesthetics. We do it on a very regular basis.
Right. And these are open for undergraduates and postgraduates both.
No, the minimum requirement is actually to be a graduate. So you have to be a registered practitioner to come in and
After your
train.
BDS is when they can contact.
Yes, yes. After you're finishing your internship, getting registered, then you can probably upscale. Because before that,
Doesn't.
I'm quite sure that no one even has a mind frame, and you're actually still finding your basic, what you've actually trained for the next 5 years. You still don't know how to put into use. So I would actually tell them that don't venture out too much initially. First, focus on what you've just learned for the past 5 years and start putting that into practice. Before that, you start doing 10 things, but you're not doing the base your basics right. It doesn't make sense. First, you get your basics right, what you've actually trained and come, and put that into use. Make sure that you start doing well for the next 6 to 8 months. You start stabilizing, your work is good, and then you start incorporating new things, and you start understanding. Otherwise, these doctors will be blank when they listen to what is happening out there, because they will be lost. So instead of being lost, just stick to the bare basics and start practicing with someone at someone's place or your own, whatever it is, but at least learn, because your real learning starts after you got your degree, you know. And then when you start treating patients morning, afternoon, evening, that is the time you actually tend to learn.
Yeah, this is such a fantastic point that you've made over here, sir, that, after you've finished your undergraduation, you really need to take some time to put into practice what you've learned, because while practicing in dental school is very different from what you actually end up doing in a private clinic, isn't it? These are two
Totally,
very separate things. So it's very important to
totally.
get hands-on experience uh, working in a private clinic. And then I think it's such a fantastic idea that once you have spent about 6 months to a year, then you can go about upskilling yourself and you start taking workshops, because then all these things will start making sense to you. Also, I think patient demography will make a huge difference. Patient psychology is something you'll understand slowly, and then you can understand the trends that are going on around you. And then, yeah, I think it's such a fantastic point. So, what are certain qualities that you would like to mention over here for students, that what are certain qualities a good clinician should have, so that they can go ahead
It's
and develop that?
first thing, you'll have to stick to the basic plan. You have to be disciplined, you have to be dedicated, and you have to be determined. If these three D's are not there, you will never progress and you will never do justice to your profession. If you're sticking to the plan and you're actually doing something, especially to the new ones who are coming into practice, I mean, there's no harm accepting that something I don't know. There are things that days that even I would end up saying that, okay, there's someone who might be better at doing this, so I'll call for help. There's no harm in doing that. If you suppose there's a graduate person who just graduated, and you've got things like root canals and all those things, coming in, and you're not trained there, learn, and don't just venture out and treat the patient as a guinea pig, that this is, I'm going to train on them. Your patients are, it's an individual sitting in front of you. You can't mess around with them. You have to take it one step at a time. Don't be in a hurry. Don't be in a rush. Once you have got your basics right, you will, as it is, reach where you want to reach. So I would just say, do justice, and the ethical practice sense should prevail all the time. You should never let go of the ethical point of view while you're treating patients.
Yeah, that's really, really important. There's a reason why we are taught dental ethics in while you're doing your undergraduation. So I think those are very important lessons that you're taught. So, moving to an entirely different topic now. So, I know that you play cricket and also football, and you're very actively involved in both of these sports. So, I think it's very important to have a hobby, especially when you're a professional and you're into a very demanding profession. It is really required that you indulge in something that you really like, so that it energizes you for the whole week or for the whole month, because it's not easy to plan a vacation. And so, what are your views on that, sir? What would you tell students over here? Because from my understanding, what usually happens is while we are in our undergraduation, we still pursue our hobby. But once you get into PG, that hobby is entirely gone out of the picture. And then after that, you obviously are old enough to get married. And then you move ahead with life, you find a job, and then of course there's no time for a hobby. But I would still suggest that people need to stick to their hobbies. It really makes a lot of a difference. So, what would you say to that?
Oh, it's very important. Everyone has a hobby, and I'm sure there's no one who doesn't find a way to let out. Uh, it's your time, and it's something that helps you grow as an individual also. Your mind needs that kind of a refreshment and something to look forward to. It can be weekend, it can be a weekday, it can be almost every day. You can probably take out some time for yourself almost every day if you feel like. But that comes with a lot of things, cricket and all. I as I told you, I used to play a little bit of professional cricket also, and fortunately, I had things like there was a lot of our cricketers who are playing now. Like there was a time when Mr.
You
Virat
played
Kohli
with
was my
Virat Kohli.
he was my roommate for one of the seasons. So Virat was my roommate, and Ishant Sharma was also in the same batch when we were playing for Delhi. And football, I've played for Subroto Cup, which is a national level tournament. I've played that twice. So cricket came naturally, and it was one way that I actually, used to look forward to. So, and yes, you're absolutely right. UG, PG, and all these times you actually PG. I'm sure I didn't get much opportunity to play. UG itself, again, I didn't have too much of opportunity to play. Again, probably on and off, but nothing very regular. But since I came back into my routine and things like that, things fell into place, and I started realizing that I have to take time out for playing, because that weekend we really look forward to. We have we even now we have a team we play regularly, and whenever given an opportunity, I play with a lot of different teams as well. But it's just hand-eye coordination now. It's no there's hardly any technique involved now. So it's just fun, and people you get to meet and you play as a team. So the team sport also helps you grow as an individual. You start interacting better. You start meeting new people. You start realizing. So you have to start adjusting and accepting. And if you can do that, even that's why team sports are so important, because it's not necessary that all 11 will be on the same page or all 15 will be on the same page. There will be differences, but you need to be adjusting, accepting. If you're wrong, you need to accept it. If you're right, you can be exertive as well. So it teaches you a lot. So team sports, for me, it worked, and we really look forward to our weekend matches whenever possible. But it's always important to have a hobby and execute it. I mean, it's easy to be lazy and just sit back and say, I used to do that. It's slightly tougher to just take that opportunity, take that one step ahead, and make sure that you're doing what you actually like doing. It's a little tough to make that happen, but once it starts happening, you will start enjoying it. People like going for their bike rides. People like doing whatever they want. They might be good swimmers, so they like to swim probably 3 4 times a week. Anything you people like to jog for almost an hour, and that's then that gives them nirvana, right? They're in nirvana there. So do whatever you feel like, but make sure that you have something to look forward to.
Yeah. So absolutely, I agree. That me time is not underrated. I think it is underrated. In fact, you really need that. You need that space for yourself so that you can recharge yourself and come out stronger. And any parting words, anything you want to tell the future generations or the younger generation actually who's going to come out?
I would just say that don't think too much. Just focus on the task in front of you. don't overthink. I mean, don't start making 5 year plans when you've already got a plan this year. You need to study, you need to work hard, you need to do justice to the subjects that are given to you. Find time for yourself. No excuses on that. Make friends. Learn to be happy. Don't repeat your mistakes. If it's in front of you, you know that you're making mistakes. Correct them. So I would just say that keep it as simple as you can. There is no complexity involved in any of the things. I think last 2 years, COVID taught all of us a lot of things, and we should take some learnings from that. Uh, give time to your loved ones. Spend time with the people you admire, and never forget yourself in that, because the last 2 years, just about COVID, we're just coming out of it, and we learned so much out of it. We lost so many, and we learned so much. So I would just say that become more giving than accepting. I mean, stop. The one thing which I actually started learning a little late in life is stop expecting, and start giving. The moment you start giving, people will automatically start giving back. So, and even if they don't be, expecting everything, that if I'm doing something, I should expect something back. Just do your best and start giving more and expect less. So, yeah, that's about it. I would just say stick to your task, keep it as easy as you can. Whatever is in front of you is what you should actually do.
These are such beautiful lines, sir, and very good words of wisdom. Actually, you look like somebody who's gotten into meditation. Do you meditate?
Not at all.
But these are very, very wise words. I have of
Thank
late been
you.
reading books so that I can keep my brain sane about all of this, and all of them talk about what you just said. Find time for yourself, be peaceful, start giving out more, be more accepting of yourself, don't expect things from others. So all of these are actually things that these books, self-help books, are teaching, and you already know all of this. So experience really accounts for something. And
It's just basic learnings. I mean, that's how we've been taught, and I think all of us will should actually thank our parents the most. Then I would never forget the opportunity to thank my wife, my younger brother, and most of all my child, who actually is my biggest hobby now, and my biggest thing to look forward to. So your family, when I said family, everything starts as a tree, and you should thank your family every day. Most of all, the Almighty above, because He's giving you the opportunity to be in and do what you're doing. So the best thing, be positive in life. Don't look back and say that all this has happened. So all that negative environment is a waste of time. You're wasting time right then, and all the moments that you're actually spending to try and think, oh, this happened, then this should not have happened. All that time you talk about that is all gone waste. Instead of that, you should try and think, okay, how can I correct that? How can I move forward? So
exactly.
invest that in yourself. Who has time in today's world? You have to make time, and you have to actually do what you have to do. So I would just say, no books, no meditation. This is just some
Plain good
common sense
learning.
and the
Yeah, yeah.
teachings and good learnings from my parents, and
Fantastic, sir.
thank
I
you.
had such a good time speaking with you, and it doesn't feel like I'm talking to you for the first time. I feel like I'm
Likewise.
reconnecting with a senior that I had known before. So thank
Very
you so much.
comfortable, and thank you. It's a real pleasure, and I hope I was able to do justice to all the things that you asked, and very kind of you to have invited me, and thought that I was worthy of it, even though I'm still a student, and we're all learning, and we're all learning. We're pretty this thing about it, and we all have to do the same. So I still thank you. I've not achieved anything in my life till now to still be here and talking to you, but if I could do something, I'm quite grateful that
No, no,
you gave
sir.
me
I
this
think
opportunity.
the sheer thought that you have about you being a student still, I think that is remarkable. You've really achieved a lot many things, and I would actually like to thank you to have spared out this time. I know you're very busy, and you came over here on my channel and you sending out this message. This is really important, since I interact with students every other day. I know for sure that this is going to motivate so many people, and seeing somebody like you who's doing so well professionally, this was a much needed uh, message that really needed to go out. So I thank you once again, and hopefully I'll
Thank you
connect with
so
you
much.
very, very soon. Thank you, sir.
Thank you so much.